Hello, I am Dr. Thompson Akwo, international physician, certified professional and expert in global health. We are part of the Critical Care Conference here in the Convention Center, and Health and Development Magazine and Media was credentialed to be part of the working medical and health media. We have done a number of interviews and spoken to a number of experts and leaders in the field on what is new, the future of critical care work. We've listened to some of the presentations that we had the opportunity to sit in. And as I said, we've produced the resources for public consumption. Life-threatening situations occur. Some of them are acute or chronic conditions. So there is the need for people to understand that those things have been done the way they were expected to be done, and that has been taken care of. So it is basically time for us to review what we have done and how we intend to go forward. We will continue to review the other interviews that we did and mount them up. Critical care is important, and it's a global issue, because we know that critical care is involved all over the world, in all the continents, in all the countries of the world. There are people who are having septicemic shock, massive life-threatening burns, trauma, road traffic accident, patients and clients who need to be airlifted to high trauma centers around the world. So critical care is actually part of global health work. If we are going to secure the health of the world and talk about global health security, improvement, and global health equity, and the health of populations in the global community, then we must have a common approach towards high quality care with marked out outputs which are acceptable by the global community. There are differences here and there in national practices and standards, but the World Health Organization is also involved in guidance, especially the low and middle income countries that depend on the partners in the World Health Organization. So critical care is very critical. It's very important. It addresses life-threatening situations and conditions and issues. And lots of people need to be involved, get to know what's going on, and be the surgeons, whether they are life-threatening events which have to do with the cardiovascular system. Most of the times we talk about securing the airway breathing, and the circulation. So in those three areas, a lot of discussions have been made how to set up endotracheal tube in intubation, ventilation, oxygen supply, and all of those needed resources that are actually very, very important in critical care situations and conditions. The head-to-toe assessment by critical care nurses is also very, very important, because the nurses are also part of the caregiving team in the ICU or the intensive care units. So they contribute. They are those who spend more time with the patients, those who get a lot of clinical history and carry out other interventions that are expected of them according to their education, training, and experiences. So they play very, very important role in that, and they are encouraged to continue doing so.